Hi, I'm Dr. Joe NIamtu, LoveThatFace.com, and thank you for following our YouTube channel, and please subscribe. So you know that I do a lot of work with lasers, and cosmetic facial surgery is my job and my passion. And I've been profiling the Syneron Candela Core laser. And today we're going to use this to treat a case of acne scarring, severe acne scarring, and generalized facial aging. Now, for acne patients, it's pretty rare that you can take significant acne scars and make them go away, but frequently you can make them better. And what we're going to do today is we're going to talk about a shouldering technique where we're actually, if we imagine the acne scar being a pothole, we're going to reduce the area around the pothole, then we're going to reduce the pothole with the laser. And then we're going to treat the rest of the face for wrinkling, skin tightening, and brown spots. Now, one of the powerful things about this laser is the multiple settings within this platform. You can do light resurfacing, you can do mid resurfacing, you can do heavy resurfacing, and we're going to show you kind of a combination of all this. Now, I know at the end of this video people are going to say, oh, we want to see before and after pictures of this patient. Well, obviously I'd have to wait 3 months to put the pictures up. There are plenty of before and after laser pictures on my website, LoveThatFace.com, and I will show you this patient 8 days after her surgery. So stick with us and watch us use the Syneron Candela Core laser for this case treatment. I'm Dr. Joe NIamtu, LoveThatFace.com. Okay, so we're going to treat some pretty significant acne scars today. And what we're going to do, I have circled the really deep pock marks, and I think this patient probably is a picker and made those even worse. And she has generalized wrinkling around the crow's feet and the glabella and perioral wrinkles. This skin's not too bad, but we're going to have to aggressively treat these acne scars. So what I'm going to do first is put them on stretch, and I'm going to go around each scar in a circle because I want to reduce the outside before I do anything to the inside, because this is like a pothole. So I actually want to go in a circle around the scars, and I'm using the fusion mode, and this is about as aggressive as I get with this core fractional laser. This is also known as shouldering on a scar. So we've gone around those, and I may do a second pass around there on some of these that are deeper. And again, when you're aggressively treating acne scars, you really have to have experience in this because you don't want to over-treat somebody. Now, what we'll do is I will treat the center of this, but with just a single treatment. And even though my laser is set at a various setting, how fast or how slow I move the handpiece has to do with the amount of overlap that we're getting. So some of it is operator dependent. Now that we've treated those wrinkles, we're going to go ahead and we're going to fill in the blanks, and we're going to treat this whole perioral region, which is a major source of aging on female skin for sure. Lipstick lines, and we're going to treat this whole thing with the fusion mode. And then we'll come back and show you some of our hybrid treatment. Okay, so we're going to show you what we've done here. I have used the fusion, which is the combination of the deep and the mid, fairly aggressive setting, and we have treated all the individual lesions, the perioral area, the glabella. I'll probably treat the nose with that, and the crow's feet. So where we had the most wrinkles, we've treated with that. Now, if you look at this topography, it still looks cratered, like kind of the surface of the moon, pothole type thing. So I am gonna do another pass around some of these. Now, I have to tell you, this is an advanced technique when you're doing multiple passes with this type of laser, and it's really something that you have to get experience with and walk before you run, because if you burn somebody, you're going to make them worse than they were. And you can see that this is flattening out pretty nicely. And remember, you don't have to do everything in one treatment. So now what we're going to do, we're going to come back and we're going to go to the mid treatment and treat the rest of the face, the lower lids. We'll treat the upper lids with light, and we'll show you that. All right, so just to show you kind of our hybrid treatment, again, this is all this T-zone here, the central oval of the face where there's more aging, that's all fusion. Now we've gone to the mid mode and we have treated this skin, and we're going to treat the whole rest of the face with the mid mode, and then the only other thing we're going to do is come back and treat the upper lids with the light mode. So let me show you a little bit of the mid mode. We're going to do the lower lids, and of course we have eye shields in. And so my whole goal with this laser is single pass treatment, except for really severe scars or aging. And I know I'm beating this to death, but that is really an advanced technique. You have to have a laser and you have to know how to ride it, so to speak, and what you can get away with, and that just comes with many hundreds of cases and experience and sometimes sleepless nights. So you just always want to maintain that safety, and this is a very safe laser if you use their recommended settings, which are, for an experienced practitioner, those are kind of low, but it'll help you get your wings. Walk before you run. So you can see this is the mid. Now I'm going to put these down one at a time, and you can see the pureness of this pattern and how organized it is for the mid mode. And we're going to go ahead and finish this, and we'll come back and show you the eyelids. Okay, now we're going to use our light core mode on the upper lid, and in my experience this would give you a result consistent with a light or medium depth chemical peel here. This is a nice setting to do the whole face on an awake patient. Obviously this patient is sedated because we're doing very aggressive laser, but you could do somebody's full face, and we do that awake with this setting, and that's the power of this laser. You know, you can use it for really advanced deep aging, scars, situations like that, or you can use it very conservatively in your practice to refreshen and touch people up. So again, this is the light mode, and again this is a fractional laser, and our goal is to do a single pass, which cuts down on time, and we've been very pleased with this. Most of the patients, even on the heavier settings, will be re-epithelialized at about 8 days. Now they may be pink for weeks for the real heavy settings like I did down here. But what I want to do is finish this, and then we're going to take a look at the whole face just to point out again what we did on this patient. So let's zoom out and look at the, got a little area here we didn't treat. Let's zoom out and look at the whole face. We've treated the severe acne scarring with the deep treatment, which is the fusion treatment, and we're going to come back and retreat this. People with severe acne are not going to get away generally with a single treatment. And then we treated the other acne in the nose and the glabella also with the fusion. We treated the rest of the face with the mid mode, including the forehead, and then we treated the upper lids with the light mode. So this is one machine with such a great toolbox, and we've been able to use all these different settings to have a personalized treatment result with this patient using a single machine. I'm Dr. Joe NIamtu, LoveThatFace.com. Hi, I'm Dr. Joe NIamtu, cosmeticsurgeryeducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high-definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to cosmeticsurgeryeducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7, as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, cosmeticsurgeryeducation.com. I'm Dr. Joe NIamtu.